October is Breast Cancer Awareness Month, but Sanford Health is encouraging everyone to think beyond just the awareness portion.
Sanford medical oncologist Dr. Shelby Turstrup joins us today to share how both men and women can take action against breast cancer. Thank you so much for joining us today.
Yes, thanks for having me.
Pink is everywhere. It's hard to avoid it, but it's an important time to have the conversation. And I want to start with maybe taking care of yourself and what we should be doing to know the risks, what we should be watching out for. Can we start with that?
Yeah, sure. I mean, I think that, you know, the risks of breast cancer are some things that we can't control. Age, you know, being a woman, and our family history. We can't really control that. But there are some things we can control, and luckily those are the things that can decrease our risk for other cancers and other diseases. You know, exercising, and really the you know, the kind of number to shoot for is 150 minutes a week of moderate activity, and you can divide that amongst the week however you want, but make sure you get your sweat on, otherwise we don't get that same benefit. So that and reducing our alcohol actually can really reduce breast cancer risk. So we kind of shoot for less than 7 drinks per week, and we prefer that to not all be on one day, and 14 for men for the week.
Right, and that's one of the stigmas out there too. Men can get breast cancer.
They can. It's extremely rare, but I do think that awareness, you know, I hate that word awareness because I feel like that's not good enough, but I think it has brought light and decreased maybe stigma of the disease, which before I don't think people talked about cancer, especially breast cancer. And I think that that awareness has led to better detection for men, because I don't think that they're as you know, scared to bring it forward.
Yeah, and we were talking before we started, you know, pink is everywhere, as you said, and October is just kind of that in your face, breast cancer, breast cancer.
Yeah.
And so sometimes it can be, you know, a bad thing, but the good thing out of it is a lot of people are now taking this time to donate to that research. How important is it that people are helping with those strives?
I mean, that is the way we're going to get cures, really. I mean, it's through research, and, you know, we would love for everybody to be part of research trials if they're, you know, offered a trial that they may be a candidate for. And sometimes those trials are people who don't have breast cancer. So you go in for your mammogram and they ask you to be part of a trial, and we actually have one coming up. That's why I'm saying this, but it's called the Wisdom Trial, and it's really to determine how we can best screen. Should we be doing every other year, or should we be doing more intense screening for other people who have higher risks? So we're really excited about that trial, and that's the Wisdom Trial. So be part of that trial. And then I think, you know, other, you know, really giving towards things that are useful, you know, that are going to make a difference. You know, we are fortunate to have a research program that is really cutting edge. And so I think giving to that, you know, those type of research programs that, you know, bring the clinical trials, bring the newest techniques in therapy that we think is the next best thing to, you know, to our local people.
Yeah, and I know I've shared with it before, but my mom had breast cancer, and thankfully when it did happen, there was a certain chemo for that type, you know, whereas years ago, that wasn't the case. And it's because of things like this, months that raise awareness, the research and the development.
Yes, exactly. I mean, we are getting so much more fine-tuned, and I think the genomics and immunotherapy is actually the big new buzzword in cancer therapy. So between those two things, you know, I think we can just hit the cancer in so many different ways, and that's ultimately how we're going to lead towards cures.
Yeah. And we'll continue to talk more about ways that you can help and do more this month after a quick break.